Hey everyone, Dr. Eva Danielle here, men's health expert. Welcome back to the channel. Now, I know what you're thinking. Did she really just make a video about poop? Yes, I did. And if you care about your health, you need to watch this entire video because what's happening in your toilet every day is giving you critical information about your overall health that you're probably ignoring. Before we dive in, do me a favor. Hit that subscribe button right now because we talk about the health topics that other channels are too squeamish to address. The uncomfortable stuff that actually matters. And only about 15% of you watching are subscribed. So let's change that. Here's the truth. Your digestive system is like the dashboard of a car. It's constantly giving you signals about what's going on under the hood. But most men never look at those signals. They flush and forget. And that's a mistake because your poop can tell you about nutrient absorption, gut health, inflammation, infections, bleeding, liver function, and even early warning signs of serious diseases, including cancer. So today, we're breaking down everything you need to know. What's normal, what's not, when you should be concerned, and how to optimize your gut health. Let's get into it. What normal actually looks like. First, let's establish what normal, healthy poop actually looks like, because most men have no reference point for this. Medical professionals use something called the Bristol stool chart, which categorizes poop into 7 types based on form and consistency. This isn't just some random classification. It's a legitimate medical tool used worldwide to assess digestive health. Here's the breakdown. Type 1. Separate hard lumps like nuts. This is severe constipation. Your stool has been sitting in your colon way too long, and all the water has been absorbed out of it. Type 2. Sausage-shaped but lumpy. Still constipated, just not as severe. Type 3. Like a sausage, but with cracks on the surface. This is on the edge of normal, maybe slightly on the constipated side. Type 4. Like a sausage or snake, smooth and soft. This is the gold standard. This is what you're aiming for. Type 5. Soft blobs with clear-cut edges that pass easily. This is still normal, but on the softer side. Could indicate you're not getting enough fiber. Type 6. Fluffy pieces with ragged edges, mushy. This is borderline diarrhea. Definitely too loose. Type 7. Watery, no solid pieces, entirely liquid. This is diarrhea. So ideally, you want to be consistently hitting type 3 or type 4. That tells you that food is moving through your digestive system at the right pace. Not too fast, not too slow. You're absorbing nutrients properly, you're hydrated, and your gut bacteria are balanced. Now, let's talk about frequency because this is where a lot of guys get confused. What's normal? Once a day? 3 times a day? Every other day? Here's the truth. Normal ranges from 3 times a day to 3 times a week. That's a huge range, and it's because everyone's digestive system is different. What matters more than hitting some specific number is consistency. If you normally go once a day and suddenly you're going 3 times a day, that's a change worth paying attention to. If you normally go every other day and suddenly it's been 5 days, that's also worth noting. But generally speaking, most healthy adults poop once or twice a day. If you're going less than 3 times a week, you're constipated and we need to address that. If you're going more than 3 times a day and it's loose, something's off and we need to figure out what. Color. What's normal and what's a red flag? Now, let's talk about color because this is where things get really informative. Your poop color can tell you a lot about what's happening in your digestive tract, your liver, and your overall health. Brown. Any shade this is normal. Poop is brown because of bile, which your liver produces to help digest fats. As bile travels through your digestive system, it gets broken down by bacteria and turns brown. Different shades of brown are all fine. Light brown, medium brown, dark brown. All normal. Green, usually not concerning. Green poop typically means food moved through your intestines faster than normal, so bile didn't have time to break down completely. This can happen if you ate a lot of leafy greens, took iron supplements, or had mild diarrhea. It's also common if you've been taking antibiotics, usually harmless, but if it persists for more than a few days without an obvious cause, mention it to your doctor. Yellow. This can indicate a problem with fat absorption. If your poop is yellow, greasy, and particularly foul-smelling, it might mean your body isn't properly absorbing fats. This could be a sign of celiac disease, chronic pancreatitis, or other digestive disorders. If you're seeing yellow, greasy stools regularly, you need to see a doctor. Pale or clay-colored, this is a red flag. If your poop is very pale, almost white or clay-colored, it means there's not enough bile reaching your intestines. This could indicate a blockage in your bile ducts, liver disease, or gallbladder problems. This is not something to ignore. See a doctor immediately. Black or tarry, this is a major red flag. Black, tar-like stools usually indicate bleeding in your upper digestive tract, your stomach or small intestine. The blood has been digested as it moved through your system, which turns it black. This could be from an ulcer, gastritis, or something more serious. Exception, if you've been taking iron supplements or Pepto-Bismol. Those can also turn your stool black. But if you're not taking either of those and your poop is black and tarry, you need to see a doctor immediately. This could be a medical emergency. Bright red or maroon. This indicates bleeding in your lower digestive tract, your colon or rectum. The blood is fresh, which is why it's still red. This could be from hemorrhoids, which are usually not serious. But it could also be from polyps, inflammatory bowel disease, or colon cancer. Anytime you see blood in your stool, you need to get it checked out. Don't assume it's just hemorrhoids. Get a proper diagnosis. Here's something important. Even a small amount of blood can be significant. If you see streaks of blood on the toilet paper, blood in the toilet water, or blood mixed in with your stool, that needs to be evaluated by a doctor. Don't wait and hope it goes away. The smell test, yes, really. Okay, let's talk about something nobody wants to discuss. Smell. Look, poop smells bad. That's normal. It's waste material being expelled from your body. It's not supposed to smell like roses. But there are different levels and types of bad smell, and some of them are more concerning than others. Normal bad smell. Yeah, it's unpleasant, but it's a familiar kind of unpleasant. This is just the natural smell of waste and bacteria. Exceptionally foul, almost unbearable smell. If your poop smells significantly worse than normal, that could indicate several things. An infection like C. difficile or giardia. Malabsorption issues where you're not properly digesting fats. Inflammatory bowel disease. Too much processed food and not enough fiber. Sweet or fruity smell. This can be a sign of diabetes or a bacterial infection. If your poop smells sweet or fruity, especially if you're also experiencing increased thirst, frequent urination, or unexplained weight loss, get your blood sugar checked. Metallic or bloody smell. This usually accompanies visible blood in the stool, but sometimes you can smell blood even if you don't see it clearly. This needs medical evaluation. The bottom line on smell. If there's a dramatic, persistent change in how your poop smells and you can't attribute it to something obvious like a big dietary change, it's worth mentioning to your doctor. Consistency issues. Constipation. Now, let's dive deeper into common problems, starting with constipation. This is incredibly common. About 16% of adults deal with chronic constipation, and it's even more common as you age. Constipation means you're having fewer than 3 bowel movements per week, or you're straining excessively, or your stools are hard and difficult to pass. Here's what causes constipation. Not enough fiber. This is the #1 cause. Most men eat nowhere near the recommended 25 to 35 grams of fiber per day. Without adequate fiber, your stool doesn't have enough bulk, and it moves too slowly through your intestines, becoming hard and dry. Not enough water. Fiber needs water to work properly. If you're dehydrated, your colon will absorb too much water from your stool, making it hard and difficult to pass. Lack of physical activity. Exercise stimulates intestinal contractions that move stool through your system. Sedentary lifestyle equals sluggish bowels. Ignoring the urge. When you feel the urge to go, but you hold it because you're busy or not near a bathroom, you're training your body to ignore those signals. Over time, this makes constipation worse. Medications Many common medications cause constipation as a side effect. Painkillers, especially opioids, antacids containing calcium or aluminum, blood pressure medications, antidepressants, iron supplements, and more. Medical conditions: hypothyroidism, diabetes, Parkinson's disease, multiple sclerosis, and irritable bowel syndrome can all cause chronic constipation. Aging: as you get older, your digestive system naturally slows down. Muscle contractions in your intestines become weaker and less frequent. Here's why chronic constipation matters beyond just discomfort. When stool sits in your colon for too long, you're reabsorbing toxins that should be eliminated. You're also increasing pressure in your colon, which can lead to hemorrhoids, anal fissures, and diverticulosis, pouches forming in your colon wall that can become infected. How to fix constipation. So what do you do about it? Here are evidence-based solutions. Increase fiber gradually. Don't go from 0 to 35 grams overnight. That'll just give you gas and bloating. Add 5 grams per day each week until you're hitting 25 to 35 grams daily. Good sources: vegetables, fruits, whole grains, beans, lentils, nuts, seeds. Drink more water. Aim for at least half your body weight in ounces. So if you weigh 200 pounds, that's 100 ounces of water per day, minimum. Move your body. Even a 20-minute walk can stimulate bowel movements. Exercise is one of the most effective constipation remedies. Don't ignore the urge. When you feel like you need to go, go. Don't put it off. Consider magnesium. Magnesium citrate or magnesium oxide can help draw water into your intestines and stimulate bowel movements. Start with 200 to 400 milligrams before bed. But check with your doctor first, especially if you have kidney problems. Probiotics. A healthy gut microbiome supports regular bowel movements. Consider a high-quality probiotic supplement or eat more fermented foods. Establish a routine. Try to go at the same time every day. After breakfast is ideal because eating stimulates the gastrocolic reflex, which triggers bowel movements. Check your medications. If you started a new medication around the time your constipation began, talk to your doctor about alternatives. If you've tried all of this for a few weeks and you're still constipated, see a doctor. Chronic constipation can sometimes indicate underlying medical issues that need to be addressed. Consistency issues, diarrhea. On the flip side, let's talk about diarrhea, loose, watery stools, usually happening 3 or more times a day. Acute diarrhea, lasting a few days, is usually caused by viral or bacterial infection, food poisoning, stomach flu. Medications, especially antibiotics. Food intolerances, lactose, gluten, etc. Excessive alcohol or caffeine. Acute diarrhea usually resolves on its own within a few days. The main concern is dehydration. Make sure you're drinking plenty of fluids with electrolytes, not just water. Bone broth, coconut water, or electrolyte drinks work well. Chronic diarrhea lasting more than 4 weeks is a different story. This needs medical evaluation because it could indicate inflammatory bowel disease, Crohn's disease or ulcerative colitis, celiac disease, irritable bowel syndrome, chronic infection, malabsorption disorders, colon cancer. Don't mess around with chronic diarrhea. It's not normal, and it needs to be properly diagnosed and treated. When diarrhea is an emergency, seek immediate medical care if you have diarrhea along with severe abdominal pain, blood in your stool, high fever, over 102 degrees Fahrenheit, signs of severe dehydration, extreme thirst, little or no urination, dizziness, severe weakness, diarrhea lasting more than 2 days in adults. Floating versus sinking. What does it mean? Here's a question I get all the time. Is it bad if my poop floats? Usually no. Poop floats because it contains gas or fat. If you ate a lot of fiber or foods that produce gas, your stool might float. That's normal. However, if your stool consistently floats and is oily, greasy, and hard to flush, it literally sticks to the bowl. That could indicate fat malabsorption. This means your body isn't properly digesting and absorbing fats, which could be due to chronic pancreatitis, celiac disease, cystic fibrosis, bile acid malabsorption. If you're experiencing persistent floating, greasy stools, especially if accompanied by weight loss or vitamin deficiencies, get checked out. Mucus in your stool. Seeing a small amount of clear or white mucus in your stool occasionally is normal. Your intestines produce mucus to keep the lining of your colon moist and lubricated. But if you're seeing large amounts of mucus, or if it's yellow, green, or bloody, that could indicate inflammatory bowel disease, infection, irritable bowel syndrome, anal fissures or fistulas. Excessive mucus production usually comes with other symptoms: abdominal pain, changes in bowel habits, bleeding. If you're seeing a lot of mucus regularly, see a doctor. Undigested food in your stool. Seeing bits of food in your poop, particularly things like corn kernels, seeds, or vegetable skins, is completely normal. These foods have outer layers made of cellulose, which humans can't digest. They pass through intact. However, if you're consistently seeing large amounts of undigested food, or if foods that should be fully digested are coming through intact, that could indicate rapid transit time or malabsorption issues. This is worth mentioning to your doctor, especially if accompanied by weight loss or nutrient deficiencies. Pencil-thin stools. When to worry. If your stools suddenly become consistently thin, like a pencil or ribbon, this can be a warning sign of a partial bowel obstruction. This could be caused by colon polyps, colon cancer, inflammatory strictures, scar tissue from previous surgery, or inflammation. Occasional thin stool isn't necessarily concerning. It can happen if you're constipated or if you've been holding it for a while. But if your stools are consistently thin for more than a week or two, get it checked out. This is especially important if you're over 50, have a family history of colon cancer, or have other symptoms like bleeding, weight loss, or abdominal pain. The gut microbiome connection. Now, let's talk about something that's revolutionized how we understand digestive health: the gut microbiome. This is the trillions of bacteria, fungi, and other microorganisms living in your intestines. Your gut microbiome affects way more than just digestion. Research shows it influences immune function. 70% of your immune system is in your gut. Mental health and mood, inflammation levels throughout your body weight and metabolism, cardiovascular health, even sexual health and testosterone levels. When your gut microbiome is balanced, lots of diversity with beneficial bacteria dominating, everything works better. Your digestion is smooth, your immune system is strong, your mood is stable, inflammation is controlled. When your gut microbiome is disrupted, low diversity, pathogenic bacteria taking over, you experience problems. Digestive issues, weakened immunity, inflammation, mood disorders, and increased risk of chronic diseases. What damages your gut microbiome? Antibiotics. They kill bacteria indiscriminately. Bad bacteria and good bacteria. Sometimes antibiotics are necessary, but they definitely disrupt your microbiome. It can take months to fully recover. Poor diet. Diets high in processed foods, sugar, and unhealthy fats feed pathogenic bacteria while starving beneficial bacteria. Chronic stress. Stress hormones directly impact gut bacteria composition and damage the gut lining. Lack of sleep. Poor sleep disrupts your microbiome. Good sleep supports it. Excessive alcohol damages gut lining and disrupts bacterial balance. Lack of dietary diversity. Eating the same foods every day leads to low microbiome diversity. Artificial sweeteners. Some studies suggest they negatively impact gut bacteria. How to optimize your gut health. So, how do you build and maintain a healthy gut microbiome? Here's what's actually supported by research. Eat diverse plant foods. The more variety of plants you eat, the more diverse your microbiome becomes. Aim for 30 different plant foods per week. Vegetables, fruits, whole grains, legumes, nuts, seeds, herbs, spices. They all count. Eat fermented foods. These contain beneficial bacteria that can colonize your gut. Good options include yogurt with live cultures, kefir, sauerkraut, kimchi, kombucha, and miso. Start small if you're not used to these foods. Eat prebiotic fiber. These are specific types of fiber that feed your beneficial gut bacteria. Found in onions, garlic, leeks, asparagus, bananas, especially slightly green ones, oats, apples, and flax seeds. Limit ultra-processed foods. The more processed your diet, the worse your microbiome. Whole foods support healthy bacteria. Processed foods don't. Consider a probiotic supplement. While food sources are best, a high-quality probiotic supplement can help, especially after antibiotics or during times of high stress. Look for one with multiple strains and at least 10 billion CFU. Manage stress. Easier said than done. But chronic stress literally changes your gut bacteria composition. Exercise, meditation, time in nature, adequate sleep. All of these support gut health through stress reduction. Get enough sleep. Aim for 7 to 9 hours. Your gut bacteria follow circadian rhythms just like you do. Exercise regularly. Physical activity promotes beneficial bacteria growth and increases microbiome diversity. Avoid unnecessary antibiotics. When antibiotics are necessary, take them. But don't pressure your doctor for antibiotics for viral infections where they won't help. And when you do take antibiotics, consider taking probiotics afterward to help restore your microbiome. Red flags. When to see a doctor immediately. Let's be very clear about when digestive symptoms require immediate medical attention. See a doctor immediately if you experience blood in your stool, red, black, or maroon. Severe abdominal pain. Persistent changes in bowel habits, lasting more than a few weeks. Unexplained weight loss. Persistent thin stools. Inability to pass stool or gas. Persistent vomiting. Fever along with digestive symptoms. Severe dehydration. Stool that's pale or clay-colored. Yellowing of skin or eyes. Schedule a regular appointment if you have chronic constipation or diarrhea, persistent bloating or gas-frequent heartburn or acid reflux changes in your normal bowel pattern family, history of colon cancer, and you're approaching screening diarrhea over 45 and have never had a colonoscopy. Don't sit at home Googling symptoms and convincing yourself you're fine. If something feels off and it's persistent, get it checked. Early detection of serious problems like colon cancer dramatically improves outcomes. Colon cancer screening. Don't skip this. Speaking of colon cancer, let's talk screening. Colon cancer is the third most common cancer in men, and it's highly preventable and treatable when caught early. Current recommendations say you should start screening at age 45 if you're at average risk. If you have a family history of colon cancer or polyps, you might need to start earlier. Screening options include colonoscopy every 10 years, gold standard, allows visualization and polyp removal in one procedure. Flexible sigmoidoscopy every 5 years, CT colonography every 5 years, stool-based tests, FIT test or Cologuard every 1 to 3 years. Many men avoid colonoscopy because they're embarrassed or they've heard horror stories about the prep. Let me be direct. The prep is unpleasant. You're going to be on the toilet a lot the day before, but it's one day of discomfort that could literally save your life. The actual procedure is done under sedation. You won't remember it. And if polyps are found, they can be removed right then, preventing them from becoming cancer. Colon cancer often has no symptoms in early stages. By the time you have symptoms, it's often advanced. Don't wait for symptoms. Get screened. Putting it all together, your action plan. All right, let's create a practical action plan for optimal digestive health. Daily habits. Aim for 25 to 35 grams of fiber from whole food sources. Drink at least half your body weight in ounces of water. Include fermented foods or a probiotic supplement. Move your body. Even a 20-minute walk helps. Don't ignore the urge to go manage stress through exercise, meditation, or time in nature. Weekly goals. Eat 30 different plant foods. Throughout the week, limit processed foods and excessive sugar. Limit alcohol to moderate amounts. 1 to 2 drinks max per day with alcohol-free days. Get 7 to 9 hours of sleep most nights. Monthly check-ins. Pay attention to changes in your bowel habits. Notice changes in color, consistency, or frequency. Address any persistent issues rather than ignoring them. Annual health care. Discuss digestive health with your doctor at annual physicals. Get appropriate screening, colonoscopy if you're 45 plus. Update your doctor on any medications you're taking. Look, I know this wasn't the most glamorous topic, but your digestive health is absolutely critical to your overall health and quality of life. Your gut affects your energy, your immune system, your mood, your hormones, and your risk of serious diseases. The good news? You have tremendous control over your digestive health through your daily choices. What you eat, how you move, how you manage stress, how you sleep. All of this directly impacts your gut. Pay attention to what your body is telling you. Don't flush and forget. Look at what's happening, notice patterns, and take action when something changes. And please, don't be embarrassed to talk to your doctor about digestive issues. My name is Dr. Eva Danielle, men's health expert. Thank you for watching, and I'll see you in the next video.